Several leading Democrats are up in arms over the Obama administration's signal that it might be backing away from a government-run health care plan. Democratic Congressman Joe Sestak says it would be very hard to vote for a health care bill without a public option. Congressman Joe Sestak joins us now from Pennsylvania. Thanks so much, Congressman. Good to see you. You're in a tough primary fight as well with Arlen Specter, a new Democrat. Congressman Anthony Weiner said today that President Obama would lose 100 votes in the House without the public option. Do you agree?
Yeah, it's going to be hard for me to vote for a bill that doesn't have the public health care plan option in it for two reasons. One is that while universal coverage of everyone is a necessity for Americans, health care reform is a necessity for America and its economy. Right now, we have 47 million Americans who are a market for the private insurance companies. In Pennsylvania, 2 companies have 60% of all private health care plan options. Without reform of a fair competitor, that's a choice, that's not subsidized by the government, only co-pays and premiums of those who elect to join it, we begin to get fair competition because they're not paying $20 million salary to the CEO. I want it because it's good for the economy. I want accessibility universal because it's good for Americans. And right now we need leadership, particularly in the Senate.
At the same time, according to the latest poll, Quinnipiac at least has Arlen Specter ahead of you by 30 points among Democrats. Yet at the same time, you did very well with the Netroots poll of the liberal bloggers last weekend in Pittsburgh at their convention. But look at the kind of town hall meetings that Specter has had to endure. Most recently, he, of course, was berated by people. Let's watch what happened at Specter's last town hall meeting.
With all kind of money to stuff in your pocket so that you can cheat the citizens of this country. So I'll leave, and you can do whatever the hell you please to do. One day God's going to stand before you, and he's going to judge you and the rest of your damn cronies up on the hill.
That's pretty tough stuff, especially for your opponent who has suffered 2 brain tumors, open heart surgery, Hodgkin's disease, has survived all of this. To have somebody face you down at a town hall meeting on health care when you've been the biggest supporter of health care and of the NIH. Do you have some sympathy for your opponent here?
What we need in America right now is sympathy and empathy for the citizens and for their anxiety that government, particularly the last 8 years, has failed them. Look, this is about leadership, and I'm very grateful that Arlen Specter has, since I announced my intent to get in the race, followed my leadership. He took off his wall in his conference room that poster board he and Bob Dole took throughout America that misled everyone about Bill Clinton's plan, even though it would have reduced premiums by 3%. And he took that off after I got in announced I get in the race. And now, 4 months ago, he said he was opposed to a public health care plan option, and now he's for it. So that's the kind of leadership, particularly by the majority leader, Senator Reid, I'd like to see in the Senate today. Look, we need this health care plan. It's not about Arlen Specter. It's not about Joe Sestak. It's not about our jobs. It's about Americans. It's about everyone having the same quality health care my daughter did at 4 years old when she had a brain tumor, and American military has TRICARE. That's the sole reason I got in politics, so everyone would have that opportunity. Principle must triumph over politics today on this issue, and no longer can we have people worried about political calculation and their job. Those senators should be down there being led by the majority leader, Senator Reid, fighting for public health care plan option because it's good for the pocketbook, it's good for the economy, and overall access for all is good for Americans. That's what we really need and what this is all about.
I know your 4-year-old daughter had a brain tumor. She's now 8 years old. She's doing very, very well. She has gone through hell and has survived and conquered this thing. Will you, with that in mind, will you refuse to vote for anything that doesn't have the public option? Is the co-op a possible alternative if the President of the United States tells you that this is what is needed?
Well, I respect the President. And as you know, I got into this race despite the political establishment of the Democratic Party saying don't get into it, because I felt we needed a new future. I'll ultimately do what's best for Pennsylvanians, and right now, without a public health care plan option or something that actually is very, very, very similar, which the present co-op proposal isn't, we won't get those insurance companies to have a fair competitor that actually brings premiums down. And because Pennsylvania's had a 90% increase in the premiums in the last 8 years, we've got to have something in that in order for me to be supportive of it. And right now I'm going to find it hard to do so unless we have that in there.
Joe Sestak from Pennsylvania, tough fight, one of the signature races that we look forward to in 2010. Thank you very much for joining us today.